How does molecular response affect chronic myeloid leukemia? Imagine a tiny battle happening inside your blood cells. In chronic myeloid leukemia, or CML, a specific genetic change called the BCR-ABL1 fusion gene drives the disease. Molecular response refers to how well treatment reduces the number of cells carrying this gene. Doctors measure this response using sensitive tests like quantitative polymerase chain reaction, which can detect even small amounts of BCR-ABL1 transcripts in the blood. When patients start treatment with targeted drugs called tyrosine kinase inhibitors, or TKIs, the goal is to lower these abnormal cells. Achieving a major molecular response means reducing BCR-ABL1 levels by at least 1,000 times, or to 0.1% on the international scale. Reaching this level is a good sign because it indicates the disease is being controlled at the cellular level. Patients with a stable major molecular response tend to have fewer chances of losing their complete cytogenetic response, which is when no abnormal chromosomes are visible under a microscope. Early molecular response, measured within the first 3 to 6 months, can predict how likely a patient is to achieve a deep and lasting remission. If the response is inadequate, it might mean the leukemia is resisting treatment or progressing. This information helps doctors decide whether to change therapy or adjust the current approach. Molecular monitoring is the most sensitive way to track disease activity and catch early signs of relapse, often before symptoms appear. Research shows that good molecular response is linked to longer periods without disease progression and better overall survival. It also provides insight into the biological behavior of leukemia cells. For example, if molecular response is poor, it might be associated with activation of certain pathways like Wnt or beta-catenin, which are linked to resistance and disease advancement. Molecular response also interacts with the immune system. Effective TKI therapy can help restore immune cells like natural killer cells and cytotoxic T cells, which can help keep leukemia in check. Some patients with sustained deep molecular responses may even be able to safely stop treatment under close medical supervision. In summary, molecular response is a vital marker in managing chronic myeloid leukemia. It shows how well the disease is controlled at the cellular level, predicts long-term outcomes, guides treatment decisions, and offers insights into the biological and immune factors influencing the disease. Always remember, each person's experience with leukemia is unique, so it's essential to work closely with healthcare professionals for personalized care.